What is Detrusor Underactivity and Overflow Incontinence? Imagine trying to empty your bladder but feeling like it just won't fully cooperate. That's what happens with Detrusor Underactivity, a condition where the bladder muscle, called the detrusor, doesn't contract strongly or long enough to empty the bladder completely. Instead of a forceful, steady stream, you might notice a weak or intermittent flow, or you might have to strain to start urinating. Sometimes, it takes longer than usual to empty your bladder, and even after you finish, some urine may still be left inside. This incomplete emptying can be diagnosed through special tests that measure how the bladder fills and empties, called urodynamic studies. Detrusor underactivity can happen for various reasons. It might be caused by nerve damage from conditions like diabetes, multiple sclerosis, Parkinson's disease, or spinal injuries. These nerve issues interfere with the signals telling the bladder muscles to contract properly. It can also result from muscle problems in the bladder wall itself, often due to chronic overstretching or blockages like an enlarged prostate in men. Sometimes the exact cause remains unknown, which is called idiopathic. Now, when the bladder doesn't empty well, it can lead to a condition called overflow incontinence. This happens when the bladder becomes overly full because it can't empty properly. As the bladder fills beyond its capacity, small amounts of urine leak out involuntarily. And like typical urinary incontinence, which is driven by urgency, overflow incontinence occurs because the bladder is so full that urine dribbles out without warning. This leakage can happen constantly or in small, frequent leaks, and it's often accompanied by a feeling of incomplete emptying or difficulty starting urination. From a bladder health perspective, these conditions can significantly impact daily life. They can cause discomfort, increase the risk of urinary tract infections, and potentially damage the bladder if urine remains trapped for too long. For people with bladder cancer, maintaining proper bladder function is especially important. Treatments or surgeries that affect nerves or the bladder muscle might contribute to detrusor underactivity, so understanding these conditions helps in managing symptoms effectively and preserving bladder health. In summary, detrusor underactivity is when the bladder muscle weakens or doesn't contract properly, leading to incomplete emptying. Overflow incontinence is the involuntary leakage that results when the bladder overfills because it cannot empty fully. Both conditions are interconnected and often requiring medical evaluation to diagnose and manage properly. If you experience symptoms like difficulty starting urination, weak flow, or frequent leaks, it's important to consult a healthcare professional. They can help determine the cause and suggest appropriate treatments to support your bladder health and overall well-being.